Welcome to Center of Balance Live. I'm Szenan from Center of Balance, the Acupuncture. Right, hi Veronica, how are you? Right, the first thing we have to do and you have to do for me is say hi to me and leave a comment down there. And the second thing, please give a thumbs up or send me a love, send me then the last thing that I want you to do for me is share this live video on your social media. If you're on Facebook, please share it. Today our topic is about UTI. UTI, what's UTI stand for? Urinary tract infection. Well, this is very, very common disease. Very common disease. But a lot of time, then when you feel it, and a lot of patients have a lot of experience, they know it's UTI. You don't have to test it. They know what they have to get. And they just go to the shop and to the supermarket and get a cranberry juice. And they drink it, feel better. In some cases, no. They reduce symptoms, but it's still there. And they have to take some medication. And they feel better by taking antibiotics. Right? Then some patients, even the antibiotic, they feel nothing. I mean, they still feel the symptom, or it reduces a little bit. And it can be acute issues, symptoms. You got painful tummy, burning while you pee, and you have to go to toilet for urinate very often. It's very urgent and so painful. You may get bloated or pain, burning sensation in your tummy. All the symptoms are from UTI. Now, it may turn to chronic problem. And the patient get it a lot often. Right. So what is UTI? This is our main topic today. Now, please leave your comment down there if you have suffered from UTI. Now, we see more in women, more cases in women. There are cases in men too, but much less. I've seen about 2, I think, in my clinic. Not many. One of them is from he couldn't pass urine and he need to put a pipe into to help, and that pipe there in causing infection, and that's one. And the other case is he just had it and he didn't know what reason that he had UTI. Right. So in my memory, I remember that I have 2 cases. Many more, maybe a bit more. I can't remember. Right. But there are many cases that I can memorize in my brain that I can still remember. That are many cases is actually in woman cases. Right. And some women, they're not coming for this condition. They are coming actually for back pain. And while the treatment, and one day they turn up and they say, "Oh, I suffer from UTI. Can acupuncture help that?" You know, "Oh, I suffer from UTI. I have been taking antibiotics and still very painful." And they just went to the toilet and it's so painful. And we put a needle in and while treating the back pain, we say, "Well, we'll this will help your UTI symptoms as well. And you press the tummy for them. Are they hurting? They say, oh yes, it's hurting in here. And after the needle, then, oh, pain's gone. Then 20 minutes after the needles, then they say, well, now you can go to the toilet again. They went in again. Oh, funny, the pain's gone. There's no longer any burning sensation. Right? So acupuncture and Chinese medicine are phenomenal for UTI treatment, especially chronic UTI. Because when it comes to chronic UTI, you keep using antibiotics, it doesn't really help. Because chronic UTI in general is because when your immune system getting low, and that happens. And we know antibiotics is good for bacterial, but not virus, right? And when you take antibiotics, it actually decreases your immune system. Well, this is why that when you suffer from UTI, if this is coming from bacterial, then it works very well. But if it's coming from virus, it doesn't work at all. Now, or if it's coming from bacterial, but you get it often whenever your immune system goes down, then you suffer from it. Then antibiotic doesn't seem to be working for these cases. We have chronic UTI patient. Now I have to find out the trigger as well. Right. Now, as we mentioned that most UTIs, urinary tract infection, are caused by bacteria, but some are caused by fungal, and in rare cases by viruses. So UTIs are among the most common infection in humans. The most common infections in humans. Now, where does UTI happen? Where could it happen? Okay. It can happen anywhere in your urinary tract, right? And your urinary tract is made up of your kidney, ureters, bladder, and urethra. So it's about 4 parts in your body that we consider as urinary tract. All right. Kidney. We know what kidney is, right? We all know what kidney is. Normally you have 2 kidneys. There's some people born with just 1 kidney, and I've seen people born with 2 kidney and 1 side. It basically in both sides in your lower back here, right? 2 kidney, 1 in the other side, and men and women are the same. Then kidney, the blood go to the kidney, and the water pass. We have 60 to 70% of water in the blood. So the blood is mainly made out of water. One biggest part of the resources in your blood is water. So the blood goes through kidney, and the kidney will get the water from the blood, so pass out the bad thing through the kidney in the water, right? So all the bad thing in the water that go through the kidney that you don't need to use it. So it's a detoxing. Now in here, we all know about liver is an organ that to detox your body, right? But a lot of people didn't know that kidney is doing the same too. Kidneys is an organ to detox your body. More in a water. It's a water filter. Let's put it there. It's a water filter, right? It helps your body to get rid of the junk, some virus, all those things in your kidney. So blood go through there, the water come out from the kidney, and from the kidney, the water need to go to bladder because kidneys don't directly connect to the outside. It can't pass it out directly. It has to go to bladder, and bladder go out, pass it out. So between kidneys and bladder, they have a tube, and this tube called ureters, right? And then from ureters to bladder, kidney, ureters, bladder, and the water goes to bladder, and from bladder pass out water to out of your body, and it through another tube that called urethra, right? So the infection may happen in urethra and bladder. The infection may happen in ureters or in kidneys too. But most often, most UTIs only involve the urethra and bladder. Bladder, urethra. Most common UTIs. So that called the lower tract. So the upper tract mean ureters, and kidney. Those are upper tract. So keep in mind that the most common UTIs involve in the lower tract, but UTIs can involve in the ureters and kidneys too, which is the upper tract, right? If it happen in the upper tract, it's actually more severe, which have kidney infection. You don't want that to happen, right? So the most common symptom for UTIs are burning with urination, frequency of urination, and blood in the urine, and you have to go urgent, and tummy pain. So the most common is when you go to pee, you have pain, and this pain is actually burning. Very uncomfortable. I never had one, so I know I don't have the experience, but I know that when patient complain to me, and patient know that they're so clever because they suffer for many times. As I mentioned in the beginning, once they feel it, they go and get cranberry juice, and cranberry juice it actually help reduce symptom. They drink a lot of it. Even if you feel pain, you should drink a lot of water because you want it to pass out all the bacteria. It help it to flush it out by drinking a lot of water, and that helps. Some patients, they ended up drinking a lot of water and they have a lot of pain. They couldn't pass out. And that's become an issue because they're passing to go, they're urgent to go, a lot of water in the bladder, but they're too painful to pass, and that is not good. They get a lot of pain by holding a lot of water in the bladder. So the pain is actually in the tummy, right? Right. Tomorrow we're going to talk about UTI symptoms. UTI symptom, a lot more symptoms that I just mentioned. And then we're going to talk about UTI symptom in men and women, you know. And then we're going to talk about UTI treatment. And every day we put a little topic. Then another day we're going to talk about the treatment. We're going to talk about Western medicine treatment. Then we're going to talk about the home remedies for UTI that I just mentioned about cranberry juice, right? And then what else? We're going to talk about how do you diagnose UTI. Then of course we're going to go to what are the causes and risk factor of a UTI. Right. Then we'll talk about acupuncture and acupressure point and Chinese herb for UTI. So if you're a practitioner, follow me and I will give you some strategy of acupuncture point. If you're a patient and you want to share this to your friend and your family, especially women, because a lot of women get it. Very, very common. Because I'm going to come up with some acupressure point that everyone can follow and you can help yourself at home for UTI. Does that make sense? Right? Stay awesome and I love you all and I'll see you tomorrow. Now leave your question down there if you share with us if you ever suffer from UTI and what kind of symptom, or whether you suffer from chronic UTI and what have you been doing to help with your UTI that is working. What have you done that hasn't been working for you? Please share with us. Thank you very much. Bye-bye.